Tummy tuck, liposuction, what is the best procedure for you to tune up and tailor your whole waist? Well, after consultation and exam, I can pretty much look at somebody's abdomen and tell you whether a tummy tuck, a modified tummy tuck, a mini tummy tuck, or even liposuction is really the best procedure for you. Many women that have had a pregnancy have expanded that whole abdominal region. And that abdominal wall is three components. There's a muscle component, fat, and skin. When there's excess skin, there's really no way to tailor that without treating for a scar in the bikini line and tightening the skin. Pregnancy as well is a great tissue expander. It stretches out that abdominal wall and it never recoils all the way. It's like an old elastic waistband that just is always a little bit boggy. So when there's that component of muscle laxity, it needs muscle tightening and I need to repair the whole abdominal wall. In doing that, that's done with either modified, a mini, or a full tummy tuck. Because we make an incision down the groin line and reflect the skin and the fat off the abdominal muscular wall. The muscles have a covering. It's a very tough fascia or fabric. That's the covering of the muscles that we take and we suture together or plicate with a very strong permanent suture. I do this from the bottom of the rib cage down to the pubic bone. Sometimes take it in 4 or 5 inches in rows of sutures to tighten your whole abdominal muscular waist. This is the part of the tummy tuck that also hurts, and I use a very long-acting local anesthetic across the abdominal wall to provide you intraoperative and postoperative immediate pain control such that most of my patients in recovery do not have pain from what I've just done. We also use a pain pump that infuses the same local anesthetic across the muscle repair the first 3 to 4 days after surgery to not eliminate the pain, but just to drop it down, such that with pain medicine and muscle relaxants, my patients do very well. Whether you need a modified tummy tuck, mini tummy tuck, a modified with umbilical float, or a full tummy tuck is really dictated by your anatomy and your degree of skin laxity and how much loose skin you have in the upper abdomen. A full tummy tuck involves removing all the skin from the belly button to the pubic region and tailoring it out as much as we need to tailor to the waist to take out all the redundant skin. In conjunction with every tummy tuck, I also use liposuction across the upper and lateral abdomen and the entire flanks to contour the whole waist, such that when you've finished, and I've finished your tummy tuck, I've contoured the whole entire waist and the front of the abdomen. Liposuction is a great component for tailoring the abdomen, given there's not loose muscle and not loose skin. If you opt for liposuction when you have any one of those two things present, you are going to accept that your results are not going to be optimal. Sometimes that's better for people because you don't have a scar, and some people are scar-phobic. But liposuction should be done in people with good skin quality, not loose redundant skin, and not significantly loose muscles. But again, these are all options, and they need to be explained to the patient with an appropriate exam, and really offering them the options and the alternatives with the proper expectations for the results with each of those procedures.